Welcome. Diabetes in India is a growing health problem with more than half of our population at risk of developing the condition at any given point of time in our lives. Diabetes mellitus is a widely diffuse chronic condition that impacts several aspects of patients' lives. If you do not manage this condition, you may develop more severe complications. And there's no cure for diabetes, but with well-managed diabetes, you may prevent many complications. Diabetes management is about more than blood sugar control. Most people are still unaware of this fact, and there's much debate about the cure and reversal of diabetes. Many are often misled by half-truths or inaccurate information. There are several misconceptions about diabetes management and treatment. So, because it's important for people to get correct information about it, we have put together a panel to discuss these and other issues regarding diabetes, and we have today with us an esteemed panel of experts. And if you have any questions you would like to ask them about diabetes, you can do so. You can just send them to us via WhatsApp on the number that's flashing across your screen right now. That's the number you can send us your questions. For our experts, don't forget to also send us your name and your location. Well, our expert panel today includes Dr. R Aravind, past president of RSSDI, Bangalore, the director of Diacon Hospital in Bangalore. There's Dr. J Mukherjee, senior consultant, medicine, diabetes and endocrinology at Apollo Multispecialty Hospital in Kolkata, and Dr. Amit Gupta, member of the executive committee of the National RSSDI Director, the Center for Diabetes Care in Greater Noida. Thank you all for your time. Quickly, I'm going to go across. Let's go across to Dr. Aravind first, because we have a WhatsApp question that's come in from Matthew from Pune, who says, I want to test my sugar levels. Which is a better test? Is it the HbA1c or is it the fasting sugar test?
I think that's a great question. I think people need to know, especially in Myths and Facts program. And thanks for inviting me into this particular program. See, we need to understand that HbA1c is the average blood glucose of the last 3 months, or what we call as the 90 days. So it tells you how exactly you have been doing in the past. It will not tell you about the present. So when we talk of fasting blood glucose, postprandial blood glucose, pre-lunch, post-lunch, pre-dinner, post-dinner, we are talking about the blood sugar at that particular moment. It's a snapshot. So in monitoring, both these are absolutely complementary. You can't say which is better. You need HbA1c because many of the great clinical trials have clearly showed us that if you monitor HbA1c, you bring it down by at least 1% or more than that, it reduces the complications. So today, diabetes management is patient-centric. When you are monitoring the blood glucose, the doctor looks at the type of a patient. It can be type 1, it can be type 2, it can be gestational diabetes, and then decides, along with HbA1c, whether you need a fasting or a post-breakfast, pre-lunch, post-lunch, or sometimes even a 3 a.m. blood glucose. So it is patient-centric today. I think the doctor will discuss this with the patient and then moves on. So both are necessary, it's complementary.
All right, both necessary and complementary. Let's go across to our next question to Dr. Mukherjee. Many, of course, wondering if they can prevent diabetes. Pre-diabetes can be looked at as an opportunity to prevent diabetes. Is it possible to reverse pre-diabetes completely? Also, is it possible to do it without taking any medications only and implementing only lifestyle changes? Dr. Mukherjee.
Thank you very much. Dr. Aravind, I would also like to thank you for inviting me. Great question again. See, pre-diabetes is the stage before diabetes. So as we say, prevention is always better than cure. So this question is perfect. Now, what is pre-diabetes? Pre-diabetes is a condition when your sugars are not normal, but you're still not reached the diabetic stage. So if you want technical answers, blood sugar value fasting between 100 to 125, or a post-glucose low 2-hour value between 140 to 199, or HbA1c, as Dr. Aravind mentioned, past 3 months control, a value between 5.7 to 6.4 is pre-diabetes. So yes, certainly we should prevent the pre-diabetic from progressing on to diabetes. And as you rightly said, in your question, there is the answer. It is lifestyle, lifestyle, and lifestyle. When we talk about lifestyle, we mean diet control, which we have already discussed in the previous programs, which we can discuss again later on if necessary, and exercise. And we will be discussing about physical exercise later on in the program. There have been large studies, one from China, Dacheng, one from America called DPP, Diabetes Prevention Program, and we have our own Indian Diabetes Prevention Program. All of them have shown that if you can control your diet and lose not huge amount of weight, this misconception that you can lose kilos and kilos of weight. No, something to the tune of 7% of your body weight. If you can lose, it can do wonders. Now, when we talk about reversal of prediabetes, I think reversal is the wrong term to use. We should be using the term remission. Now, most of the studies were from preventing a pre-diabetic going on to a diabetes, but in those studies, a fair number of people got their blood sugar values into the normal range, i.e. fasting below 99 and below, or a post-glucose load or postprandial glucose 139 and below. So that is possible, and both the Chinese study and the American study have followed up patients for 15 to 30 years on these lifestyle modifications, and they've shown that you can maintain this. If you lose about 7% body weight, maintain your diet, you can reduce your risk of progressing to diabetes by as much as 55 to 60%. Last 10 seconds regarding medications, yes, a number of medications have been tried in the pre-diabetic phase. Of these, only metformin has cut the ice. But having said that, none of the associations approve a pharmacological agent for preventing pre-diabetic to progressing onto diabetes. Having said that, we doctors sometimes use metformin in certain groups of pre-diabetic patients, but leave that for the specialists. Back to you.
All right. Well, talking about fasting, the next question has to do with that too. Intermittent fasting, Dr. Gupta, this question for you, can be a way to lose weight. It seems to be the fad, certainly, all around. But is it possible to put people with diabetes in remission? I want to use that word, doctor, since you said that's the right word to be used here, in remission, using intermittent fasting, Dr. Gupta.
Thank you. First of all, I would like to thank you for having me here for this program. I would like to tell you that intermittent and fasting is becoming very, very popular, and it has been advocated as one of the means of losing weight and also one of the method of controlling diabetes. But let me tell you, there are very few studies, and these studies are very limited in nature. And if I can remember, there is only one randomized trial, and there are only few case reports where it has been seen that intermittent fasting can be of value in losing weight as well as in controlling diabetes. But it is important to understand that it is not everybody's cup of tea. One has to understand that if somebody is planning intermittent fasting, that they need to be under supervision of a medical practitioner and a expert. They need to monitor their blood glucose levels regularly. At the same time, there are certain other parameters which are to be monitored regularly, and it should not be attempted without any supervision. And now many people are studying this aspect of intermittent fasting, and probably we will have very good guidelines which will tell us that how to do this and how to inculcate in clinical practice. But right now, most of the talks about the intermittent fasting is coming from the animal studies, or it is some weight loss gurus who are advocating it, but the medical world is having limited evidence about that.
All right. Another question quickly coming in for Dr. Aravind. Doctor, why do some people, this viewers asking, why do some people with diabetes need insulin therapy, Dr. Aravind?
I think I'll just take a little extra time to answer this, because of late there's been a lot of claims that one can stop insulin even if you are type 1 diabetic and things like that. And even today we had a patient with a blood sugar of 500, and then when I said I would like to start you on insulin, it's often thought that insulin is like a drug addiction. When once you start, you take it for life. So let me clarify certain facts to the audience today. Diabetes is a condition of either an absolute insulin deficiency, what we see in type 1 diabetes, or relative insulin deficiency with insulin resistance, the way we see it in type 2 diabetes. If you have type 1 diabetes with no insulin production in your body, well, you need insulin from day one. You need insulin at least 3 to 4 times a day so that you lead a very healthy life for as long as you want to live. Now, those with relative insulin deficiency, like what we see in type 2 diabetes, even endogenous insulin production may not be stabilized. So you need it in such.
Dr. Aravind, sorry, I can't hear you very clearly. I'm just going to ask you to perhaps possibly reconnect, and then I'll come back to you and you can pick up from where we left off. But I'll stay with the issue of insulin. Dr. Aravind, Dr. Mukherjee, then talking about insulin, hypoglycemia is common in people who take insulin injections. What could be the reason for that, and is that preventable?
Now, a very, very relevant question. See, what is hypoglycemia? As the word mentions, hypo means low, glycemia means blood sugar. So by definition, when your blood sugar values go below 70 milligrams per deciliter, you start getting symptoms. But see, hypoglycemia is one of the biggest limiting factors in treating diabetes. As Dr. Aravind was mentioning, people with type 1 diabetes require insulin from day one. And many type 2 diabetic patients, after a while, when the medications do not work, need insulin. Not only insulin, but certain drugs used in people with type 2 diabetes, like sulfonylureas and glinides, can also cause hypoglycemia. So it's not just an insulin phenomenon. Certain medications which secrete insulin from the beta cells can also cause hypoglycemia. Now, hypoglycemia is divided into various levels, level 1, level 2, level 3. And when a person, I don't know if some diabetic patients are listening to this program, when they get the first episode of hypoglycemia, they get very, very frightened. Why? Because they've never been told before about it, they were never experienced something like this before. What happens is they start sweating profusely, start shaking, get profound hunger, the consciousness starts getting clouded, motor function starts deteriorating, and if they don't intervene, they may lose consciousness, get into coma, and get a convulsion. So whenever a person started on insulin or given medication which can cause hypoglycemia, the doctor or the nurse or the diabetic nurse educator informs them, educates them about hypoglycemia. Hypoglycemia is part and parcel of the treatment of type 2 diabetes with insulin or type 1 diabetes. Do not be afraid of it. Be aware of it. Treatment is very, very simple. You just need to take 50 to 20 grams of carbohydrate, glucose, and best is 3 teaspoonfuls of sugar, 3 spoons of glucose. But mind you, you need to eat something after that. If it is closer to your meal time, have your meal. If not, have a snack. Why? Because otherwise the hypoglycemia can happen again. And your question, why does hypoglycemia happen? It's very simple. It's a mismatch between the calories that you're taking and the insulin dose or the oral hypoglycemic agent that you're getting. Suppose you take insulin in the morning, you had breakfast, lunch was at 1 o'clock, you missed lunch because you have an NDTV program. You have to come running for the program. So what happens? You miss your meal, and that's when you get hypoglycemia. So always carry some food, and certain people are more prone to hypoglycemia. Children, elderly people, people who have got kidney dysfunction. So your doctor will inform you that, look, you're at higher risk of hypoglycemia, always carry some food. When we come to the exercise part, we'll discuss that when you go for exercise, do eat something, carry something with you when you go. So in one line, hypoglycemia is low blood glucose reaction. You may get it when you're on insulin or certain medications for type 2 diabetes. Don't be afraid of it, be educated about it, and prevent it. Back to you.
All right, Dr. Gupta, well, if that's the answer, the problem is, though, that some people with diabetes who are on insulin therapy believe that being on insulin then means that you don't have to make any lifestyle changes, even though we know that healthy eating habits are crucial because what you eat affects your blood sugar. What would your advice be for such people, Dr. Amit Gupta?
You have asked a very, very important question, and many times what the patient does is that if they are on insulin therapy, they believe that since they are taking insulin, lifestyle modification is not required. I think this is a myth, and this is very, very wrong. And lifestyle modification, or the LSM, what we call, is at the forefront of diabetes management. It is the first thing which is advocated by all the organizations of the world, including our organization, Research Society for the Study of Diabetes in India. And it has its place at almost every stage of diabetes. If somebody is having some medical conditions that limits some physical activity or some specific type of diet, otherwise it is indicated for each and everyone, irrespective of the fact whether they are taking insulin or not. as rightly pointed out by Dr. J Mukherjee earlier in the program, that lifestyle modification has multiple components. One is the diet, second is the physical activity, and it also includes behavior changes like smoking cessation. So, the diet, as you can easily understand, if you eat a balanced diet, it will keep your insulin requirements in check, and it will also minimize the glycemic excursions and will also prevent the risk of hyperglycemia as well as the hypoglycemia. Second thing, we all know that if you indulge in a regular physical activity, you do regular physical activity, you are likely to have better peripheral glucose utilization, and this is going to reduce insulin resistance, and this can again bring down the requirements of the insulin. So if you are on insulin therapy, please do follow the instructions given by your treating doctor so that you can get benefit from the regular lifestyle modifications.
All right, we have to take a break at this point of time. So let's go in for that and then take the other questions on the other side. Welcome back. We're talking about living with and managing diabetes. We have all our doctors still with us. So Dr. Aravind, I want to quickly set the ball rolling again. What are the most important metrics for managing diabetes?
Oh, well, see, diabetes is not just, blood sugar disorder, and then we call it a metabolic disorder and a vascular disease. So we need to really be very careful when we phrase this word. So it's not just the glycemic control, but you need to take care of your blood pressure. You need to take care of your dyslipidemia. You need to take care of your body weight. So this is the most important thing. So when we talk of taking care of obesity, the lifestyle changes come into picture. And when you are looking at the metrics to actually test the blood glucose levels, it's not just the blood glucose, then it's also many other metrics come into the picture. Something like glycemic variability, time in range, or the new concepts that are actually coming into the picture now. So we are going to be trying out a number of our patients on continuous glucose monitoring. Now, apart from glycemic monitoring, I think the most important thing is take care of your blood pressure, take care of your lifestyle changes, especially your weight, dyslipidemia, and blood pressure. I think this has to be done day in and day out, right through your lifespan. And then you need to not only have a knowledge, but used to have a good attitude and discipline to follow this.
All right, so if we're talking about lifestyle management, we're talking about, controlling your weight, then Dr. Mukherjee, regular physical exercise is a major part of diabetes management, right? So when is the best time to exercise for people with diabetes? What type of exercises are safe for people with diabetes? Dr. Mukherjee?
Thank you again. A very, very pertinent question. As Dr. Aravind mentioned, you see, people sometimes have this concept that I have diabetes. I will go and meet my doctor. He will give me certain medications and my diabetes will be controlled. Unfortunately, diabetes is not that kind of a disease, not a cough and cold, or not like a blood pressure, I give you one pill. See, diabetes is a lifestyle condition, as Dr. Aravind mentioned. So it requires a huge amount of input from the patient's side. We have talked about diet. Dr. Amit mentioned quitting smoking, and certainly physical activity or exercise. Now, when we talk about physical activity or exercise, we get confused. See, the first thing is physical activity. And it's always said exercise, but we see so many patients, many of our patients fall along the way. They don't exercise. Why? Because of many reasons which prevent them from exercising. So my first advice to them is physical activity. I mean, we, in the present day, online, everything is online, we are sitting on the chair. Avoid sitting for more than 20 minutes at a stretch. Get up, walk, do some household work, do some gardening. So this is called physical activity. After that comes exercise. Now, you asked which time of the day to exercise. Any time of the day, but make sure that you do it most of the times at the same time. Otherwise, you will forget. You see, you should have some kind of a system. Otherwise, the first thing which you forget to do is exercise, then something else comes into your life. The next thing is how much of exercise. It's about, medically speaking, we say 150 minutes per week. But for simple communication, it's about half an hour per day. About 5 days a week should do. You should not let more than 2 days pass without exercising. And what exercises? These are called aerobic exercises. The heart rate should go up, you should pant a bit, you should sweat a bit. So what are those? brisk walking, jogging. If you're into gymming, you can go to the gym and jog, Bollywood dancing. So all these kind of aerobic exercises. And along with this, you should do something called isometric. Isometric is building up your muscles, So it carries a little bit of weights, not very heavy weights. No need to go to the gym. So if you build up your muscles that Dr. Amit was mentioning, that will also have a great impact in controlling your diabetes. You should have a basic check done before you get to do exercise. Not a huge amount of investigations, a simple ECG, and your physician should be able to tell you whether you need to do more advanced tests before you go on to exercise. But for majority of the people, if you can climb 2 flights of stairs without any problem, you can do exercise. When we were discussing hypoglycemia, I mentioned that if you're on certain kinds of medication which cause hypoglycemia, if you're on insulin, you should be careful, eat something before you go out for your exercise. There's certain kind of type 2 diabetic patients who are advised not to do heavy exercises, so please make sure you meet your doctor and find out. You should not have bad knees, should not have very bad diabetic retinopathy, or should not have bad neuropathy which has damaged your feet and your feet are vulnerable. So in summary, my humble request to all type 2 diabetics, please, it's a lifestyle disease, take care of your diet, please exercise. If you do not do exercise, please do physical activity, get up from your chair, walk, and please try to put in 30 minutes a day. With that, back to you.
All right, doctor, that's great advice, not just for people with diabetes. I think it holds for everyone. Let me try and squeeze in one last question, a little shift of gears here. Dr. Gupta, to you, if you live with type 1 or type 2 diabetes, continuous glucose monitoring or CGM can help you make more informed treatment decisions that lead to better glycemic control. At which stage of diabetes should it be considered for use? Dr. Gupta, last question to you.
Thank you very much for asking this technologically advanced question. And we know that CGMS, or continuous glucose monitoring system, is a kind of device where you put a simple sensor non-invasively on somebody's arm, and this can record blood sugar continuously. And this data is then transferred to the reader and or sometimes even the smartphones also, and one can have a regular look into the blood glucose levels. As you asked that how it can help a patient living with diabetes, so it can help you make many informed decisions which a patient living with diabetes has to make throughout the day. It may be regarding the food intake, it may be regarding the exercise, it can also be regarding the insulin delivery. So this type of monitoring actually satisfies a long-held wish of patients with diabetes. So using CGM systems in daily life can be beneficial if patients with diabetes systematically make therapeutic interventions to optimize their diabetic management. Also, it can be of good value in identifying the risk of hypoglycemia, especially the nighttime hypoglycemia, because when you are sleeping, you cannot check by finger prick. So a device like CGMS can pick up these episodes of hypoglycemia. Also, it can be used in patients with type 1 diabetes who are on multiple insulin injections, as well as type 2 diabetes who are on multiple insulin injections, as well as OHA. Also, it is a very good tool to understand one's own lifestyle. That is, what is the impact one is having on their blood sugar levels throughout the day. And now many sensors are available which can give you which can record your blood sugar level ranging from 5 days to up to 14 days. In fact, implanted sensors can give you a reading up to 3 to 6 months also. So these are the devices. I think they are going to be of great value in future, and we are also using them currently in our clinical practices.
All right, we're completely out of time, but of course we'll be back because there are many, many more questions, queries, fears, myths to address when it comes to diabetes. But for now, thank you, doctors, for your time. Thank you for your service. Bye-bye.